fibroids, but never was fibroids considered until about a year and a half ago. My African American doctor suggested that I get a scan, and then the scan showed that I had fibroids. But over the years, I had those symptoms, but because I'm in menopause now, the fibroids have shrunk because of low estrogen and progesterone, which is normal in menopause. But it really is alarming to me that I had so many symptoms. I had hair loss, I had heavy menstrual cycles, I had fatigue, and hair loss, as I mentioned, and it was never considered. And so that really bothered me once I realized that fibroids could have possibly been the reason for all of that.
And, because it's not discussed a lot, we don't always recognize those symptoms as fibroids. Dr. Hawkins, I will tell you, I had a scar as a result of the hysterectomy, and I was so shamed about it and self-conscious about it. And how I knew this problem was so prevalent is because, when other women, I would talk to them, they'd say, oh, let me see your scar. Look at my scar. And everybody had this scar. So because it's so common, the treatment is also questionable, right? So why are so many Black women treated with hysterectomies when there are clearly other options? I made the choice that was best for me, but some women do not want to go that route, and yet they feel like that's their only option.
Yeah, and a lot of that lays on the healthcare provider. I will say that we should take full ownership and not, unfortunately, sometimes providing women, especially Black women. There are studies that have looked at this with minimally invasive options, meaning could we have done this laparoscopically instead of having such a scar as the one that you're saying that you had, or do they have other options altogether? There are options now to shrink fibroids. Of course, there are options to just remove them or do what's called an embolization. So a lot of times that is the responsibility of the healthcare providers to let you know. Unfortunately, the truth is a lot of providers will feel like a hysterectomy is just an easier route to go.
That is unfortunate. And Ms. Wanda, I think you brought up something really important, and that's being menopausal while going through fibroids, which those symptoms may take on an entirely, different look when you're menopausal. Talk about what it's like going through fibroids, also going through menopause. Did it exacerbate, hot flashes? Did it impact, your mood? Just explain what you're going through.
I would say yes. The hot flashes are on 100, I must say. And gosh, it's hard to deal with. But and it has affected me. My hair recently just started falling out and thinning out, and I had really big hair, so that's been. My doctor told me that's a possible symptom of fibroids. And as we discussed with the Black Women's Health and Heritage Roundtable last week, there are symptoms during menopause that sometimes are attributed to other conditions. Like I have thyroid issues, I have some other health issues, and some of the symptoms have been attributed to that. And as I said earlier, it was never brought to my attention that it could possibly be fibroids. And so now I am really researching some of the symptoms that I'm going through in correlation with other illnesses along with my doctor to see, in fact, if I should take the next step and have surgery. I don't want to get a hysterectomy, even though I'm in menopause. That's just a part of my womanhood that I just don't want to let go so easily. And so we're coming up with some different ideas of what we're going to do next. And so I'm now in the process of figuring out how we're going to deal with the fibroids.
Well, keep us posted. We definitely want to keep up with your health, Ms. Wanda. And Dr. Hawkins, a lot of people, my friend Brittany Packner-Cunningham says we should have a book on what to expect when you're aging, the same way we do, and what to expect when you're pregnant, because what we go through in our bodies, it's constantly changing each decade, it's felt like for me. But for women who, saw my testimony and they're like, oh, no way, I don't want to be in the hospital for weeks. Sometimes people are in the hospital for hours. It's not even an overnight surgery, so everybody's different. But can you talk about what impact fibroids may have on fertility? Because for people who are younger and do want children, they may have a lot of questions about the best treatment for them.
Absolutely. And I think one of the things that comes to a lot of women's mind as soon as they find out their diagnosis is their fertility, especially if they may have been asymptomatic. A lot of women find out about their fibroids when they're pregnant. They find out with their first ultrasound, which leads me to the point that you can get pregnant with fibroids. A lot of times it depends on the location and that symptomatology and your ability to try to get pregnant. Unfortunately, there's also that subset of women who have a very difficult time getting pregnant with fibroids, again, because of that location. Location is what matters. And I always encourage women to partner with their primary GYN physician as well as a reproductive endocrinology physician, a subspecialist in here to say, okay, do these fibroids need to be removed? Is it okay and healthy for me to get pregnant with fibroids? Am I looking at an increased risk of things like miscarriage and preterm labor and preterm delivery? Because we don't know how to predict exactly affect it.
All right. Well, I'm so thankful to you guys for having this conversation. Like I said, everybody's different. I had 5 grapefruit-sized fibroids that had to be removed. Some people have smaller, more, less. So everybody's different. Please talk to your healthcare professionals. And thank you, Dr. Hawkins and Miss Wanda, for being here. And Miss Wanda, good luck to you. We'll keep in touch with you on your health as you go forward. Thank you, ladies. And coming up,